I am an MD, a medical doctor. As a second career, I was a music teacher in my first life, and I went to medical school because I had chronic issues, and many of my friends and family did too. And it seemed like that Western medicine did a lot of things well, but dealing with chronic issue, not so much. And so I wanted the Western side sort of for credentialing, but I wanted to continue to do my study that I'd done my whole life on sort of integrative, holistic medicine. And so that's what I've continued to study. And recently, I think honestly, I can say after I'm in my 5th month now of being on the patches, Karen was my wonderful sponsor coming in, and gotten to know Marcy and so many of the rest of you. I really do believe that the Lifewave patches are the most progressive, cost-effective, safe, and super effective for patients of anything I've seen out there. And I was just talking with a patient yesterday, and she has some major issues with her gut. And she's just not absorbing the supplements she's taking based on her labs and her symptoms that we were talking about. And I said, we've got to get you on the patch. I've got one on right here. Because I said, it's no drugs or chemicals or supplements you've got to absorb. It's simply going to stimulate your body. You'll be able to tolerate it. It'll be safe. And I feel certain it'll be effective based on all of the studies we have in our case reports. So that's it in a nutshell. I love what I'm doing. Thank you.
So why did you feel the patches would work for her? What's in that type of technology that makes you feel like it could work for her where supplements couldn't? What's going on with the digestion that makes supplements difficult, but that makes light photobiomodulation, which is light making change in the body? Why would that work for her?
So it's almost like everything else we know, it has to come from within us, right? And so when we can harness our body's natural healing ability, then it's going to be the safest and the most effective. And for her, she has some symptoms of long COVID and some other issues. And so her gut lining has just sort of been ripped apart. It's very leaky. She's not able to absorb. We put a patch. This is something that's going through light activation or photomodulation, as we call it, but it's completely bypassing the gut. We're not relying on any of our organs to be good enough for whatever we're doing to work. We're just going to harness and utilize what we've got. And that bypasses her gut. And so it's the best choice, I think, for her and most of us, because all of us tend to have some gut issues.
Wow, I just got chills on that.
Yeah.
Because I've always thought that was truth, but it's nice to hear from a doctor what that really means. And I think what I'm hearing, doctor, is that supplements, pharmaceuticals, food has to be processed in the gut, and then it moves from the colon into the bloodstream and absorption for your body to use it. But that photobiomodulation, or a type of light, call it, ours is wearable light, but even red light sauna or cold laser, light therapies, they're light. And so they just move directly in. There's no absorbing in the colon to use. You're just going to go make those changes right in the bloodstream. Is that correct?
That's right. And of course, our goal is to get our gut healthy, right? So we do work on that as well while we're taking patches or doing whatever. We want to be able to absorb our food and our supplements as needed. And so that's why we're using the patches to help us to get better and then to keep us healthy after we begin the repair stage and move to the rejuvenative stage.
Well, doctor, give us a little more on this mechanism of light.
So I love the way David Schmidt calls it photobiomodulation. And that's a long word, but if you think about it, photo meaning using light, and bio meaning that it's going to affect the biology, the working of your body, right? And modulate it according to what it needs. And so the idea is there's no medicine in this patch. So a transdermal patch has medicine that you're taking in directly into the bloodstream. This patch has no medication or drug that we're taking in. We're simply putting it on a directed place in the body based on certain energy meridians in our body and acupuncture points. And so we're putting it there to help deflect that infrared light that our body pushes out all the time back into our body at these selected spots to activate, to modulate what we're doing. So if we need a little more or a little less of something, it works. Ayurvedic medicine often talks about adaptogenic herbs, and those can be very powerful for the patient. But again, there often, or sometimes at least in my experience, there can be some side effects in taking those. This is a modulation, and that means that it's going to be something that uses it in a way, as David says, our body, how it needs it exactly. And that's what makes me feel good about using it as safety and effectiveness for my patients.
Shyler, Dr. Patty was just, I just explained the stem cells and how they work. And my question to you, Dr. Shyler, is how long have you been using the stem cell patch on yourself and your patients? And what have you found for yourself and your patients as it relates to the X39?
The first thing that I noticed, I was put the stem cell activation patch on April 2020, April 1st. And when I took the patch off that first night, it took me right back to the bicycle accident where I was knocked out. And I had this kind of zigzag feeling in the right side of my head that happened at the accident. And I knew I had hurt my low back, but I didn't understand it hurt my head. So I talked to Dr. Horman. He said, yes, you can get anxiety based on getting a head injury. And I could get caught up in a loop after that particular situation. So that was the first thing that happened. Was I felt the same situation that night. And what happened on day number 10, because I was meditating every day, not medicating, and the anxiety that I had experienced for a while lifted after a 20-minute meditation. That was the very first thing.
Mm-hmm.
Secondly, my energy, I'm in a clinic where I see between 60 and 80 patients a week. We're extremely busy, and I could get tired. But with the stem cell activation patch, my energy, I was up on the weekends at 7 o'clock on my bicycle at 7:30. It's just amazing. So the energy was awesome. My hair's the longest it's been in over 10 years. I love that. And my sleep, I sleep like a 10-year-old now. You can't beat that. Your body needs to regenerate and repair.
Wow. So, doctor, explain. I get the sleep. I get the hair. I get the energy, but I'm a little confused about this accident. So you had this bicycle accident when, and was it the accident what's that called? Is it called retracing maybe? Like what, tell me more about this.
So in 2008, I had a bicycle accident where I was knocked out. And so I woke up, I was sitting on the ground in the park, and I felt okay. I thought my head was okay, but my back was hurt. So I used a laser on my back. I used all these things. My back is fine now. So when I took the first night, I took the stem cell activation patch on. It took me right back to that situation. I felt the same zigzag pattern I had felt from time to time. And I just realized, oh my gosh, I think I hurt my head. And Dr. Horman confirmed, yes, if you get hit on the right side of your head, that can cause anxiety. I was watching David Schmidt's brain mapping studies, amazing. And so your brain's important, right? So it went to my brain, it healed my brain, the anxiety disappeared over time. It was amazing. Does that make sense to you, Marcy?
I think so. So
okay.
In 2008, you had this horrible bike crash, and you had zigzaggy, you had brain injury, it sounds to me.
What happened was 2 weeks after I'd gone to, after the accident, I went to see my dentist. I'm sitting back in the dental chair. My dentist is great. I freaked out. I had a panic attack. And so that's when I realized something happened, but I didn't connect the dots. So in 2020, April 2020, I'm watching David Schmidt's brain mapping studies, and I realized, oh my gosh, I think I had hurt my head. It went to my brain first thing I've experienced, and my anxiety disappeared. It's like a lovely thing.
So I see. So you started, you had the accident in 2008, the injury, the anxiety. You started the patch in 2020, and you had like a retracing, like you almost felt your
Yes.
brain feeling like it did in 2008. And it was probably just retracing the injury
Yes.
to fix it. Is that what you think?
Yes, that's exactly what happened.
Wow. And then the anxiety from the last 12 years, you don't have like you did. Is that right?
No, it's amazing. But on day number 10, because I would call Bob Campbell, I'm listening to people tell their amazing stories. I want results 1, 2, and 3 days. But on the 10th day, I meditate, do not medicate. I'm doing my, I've actually put the stem cell patch on my heart chakra. I did my 20-minute meditation. At the end of that 20-minute meditation, it just lifted. It was amazing. Day number 10, April 10th.
Day number 10, through meditation, the X39 on your heart, the anxiety lifted. I got it. What the X39 does and why MDs are using stem cells for patients. And maybe you could help us understand a little bit why Dr. Shyler had such the experience she had.
That's so interesting because the first day I put on the X39 patch, I had almost a euphoria. I would say just the greatest sense of well-being and like all is well, you know, just the way we always want to feel and live and sometimes fall short of that. And so I know that there is a connection there because I also have had stem cells themselves injected into me because I have multiple sclerosis, and I was using this as a treatment for myself and then became so convinced I would have that same kind of euphoria right after that procedure. That procedure, of course, is thousands of dollars. This procedure is one patch. So not everybody's going to feel that way. In fact, I have some patients that will tell me they don't feel anything the first few days or even month that they are doing it. And I say, you need to give it time, a decade of your life, at least 1 month for every decade. And I explain to them that sometimes stem cells, what they do is they go to areas of greatest inflammation first, like maybe your liver, and you're not going to feel anything. So I think that's a great thing. And I love the fact that even though the FDA stopped our ability to use stem cells here in the United States like that, we have the ability to make our own body, help our own body, support our own body to make more stem cells and to take the stem cells we have and make them more effective.
We cost less than a cup of coffee a day. Like, you were doing stem cell injections. What did they cost? Like, what does it cost to go get an injection of stem cells?
Yes, it's very expensive. Go ahead, Dr. Shyler.
8,000 a shot. We were doing stem cell injections in clinic.
For $8,000 a shot. Can you imagine? And that is not even your own stem cells.
Right.
So what is exciting about the X39 is we are not putting other people's DNA in your body. We are non-transdermal. We are just activating your stem cells through light. Dr. Shyler, thank you for sharing your experience. I really, really appreciate it. Do you have any other testimonials? Are you sharing the X39 within clinic within your clinic? And if so, what are you seeing there?
Pain relief. Patients don't need to come in quite as much for acupuncture because the holy grail of anti-aging and health is going to be stem cells. That's what it is. So people's back pain goes away, sciatica goes away, neuropathy goes away, just elevated feelings of goodness and joy. It's just amazing. I'm so thankful that David Schmidt is who he is and has provided for us the ability, the tools and resources we need to have healthy lives.
So Dr. Patty, other than, I wanted to ask you a little bit about GHK copper peptide injections, and were you doing those, and do you do those much anymore, and why?
Yes, so GHK copper is a short chain amino acid that your body makes naturally, and the regenerative community has tapped into injectable peptides. And what that means is that patients purchase a little vial and they get themselves small syringes and they inject right under the skin every day for a month and cycle a little bit off and on. And it can be very helpful, and it's really caught on. I've used those myself, and they are good from my perspective. Again, I can only speak from just my personal perspective and what I can tell patients regarding case studies and reports. But I found that this patch X39 that was going to stimulate the same thing, GHK copper, in my body, and I wouldn't have to inject every day. Those cost about $350 a month for that one thing. We're getting a stem cell activating patch and GHK copper activating pathway patch for much less than that, as we all know. And you're not having to inject. And of course, many people don't want to stick a needle into themselves, even if it's a tiny one. So I am recommending this for all of my patients. The peptides have to be refrigerated and shipped on ice. And of course, that's what makes them so expensive. So this is a great way to go, and much, I think, more cost effective. You're not injecting the peptide into yourself. Again, you're activating your body's healing mechanism. And that, to me, is the very best way to go.
And I love that. What blows me away, Doc, is that before you even learned about Lifewave's X39 stem cell activation patches, let's just talk about this for a minute. You were already injecting GHK copper peptide in your patients. You were already doing stem cell injections, and you understood photobiomodulation. You were doing all of it. And then all of a sudden, your patient comes in with a little sleeve for $99 a month and said, this little patch can do everything you were doing. It's kind of amazing, right?
Yes, it is. And that's one reason that drew me to it. My patient, I listened to what she was telling me, and I was so happy that she was doing so much better with the pain that she had using Icewave and X39. And so I have pain at night. So I decided, yes, I need to investigate it, but I was pretty suspect, it can't possibly really work. But then I began to delve into it and realize that we had lots of studies that showed it. The mechanism of the photobiomodulation made sense to me, and I thought it's worth a try. And
what do you have as it relates to symptoms of MS, and what is this Icewave, and how are you using that in conjunction with X39, and what's this all about?
So I'm very hopeful about the X39 for many of my symptoms. And I try, like most of us, we try not to identify with the disease itself, right? We may have symptoms, we may have been diagnosed with something, but we don't have to take that on as our identity. And so I love that as I am hurting, I help others, right? As I am being healed, I can be a healer. As you are being healed, you can be a healer. And so we learn from our pain and our suffering. And for me, when she was talking about pain, I thought, oh gosh, I have so much pain at night. That's where my pain is just severe, or was, I have to say was now. because I've been using the Icewave patches for about 5 months. But the very first night I used them, my pain was reduced by 50%. And within 3 nights, my pain was reduced by 80%. And now my pain, I would say, is about 90% reduced, meaning I almost have no pain at night. It's truly incredible.
So doctor was blocking her full body, because this is one location. But what if you're like Dr. Patty and you got pain everywhere? How did you block your full body pain, Dr. Patty?
Well, I looked on the website and under the Icewave patch, scroll all the way down to the bottom. You can do this for every patch. If you haven't seen it, it took me a little while to find that. And it tells you usage and their videos and written material about places to place the patch. And it talked about whole body pain. You put 2 on your feet, underneath your feet, sort of in that pad, a white always on the right, the brown on the left. And then you put the other 2, white on the right, brown on the left, wherever you want to sort of encircle the pain. So initially, it recommended doing it at the wrist and then moving it up. And by the time I got to my elbows, so the top 2 were here and the bottom 2 were under my feet, white on the right, brown on the left. That's when my pain was reduced about 80%. And I left it on my elbows until I heard David Schmidt talk about you could move it to your shoulders. And I thought, oh, that would be wonderful because I've got torso pain. And so I did that. And now I truly, it's like you feel like you have a blanket from here to the bottom of your feet. And that's why my pain, I believe, has been so reduced.
How you really do work your office for your patients, like how you make sure the right products get to them, how you're really running that in your office, doctor.
Sure. And most of my practice is remote. I have medical license in several states. And I do have a local practice as well in San Clemente, California, but most of my practice is remote. And so that's another super good reason to use the patches, because if clinics do get closed down again, like it's what happened in the past with COVID, your business won't just go down to zero. This is something we can use all the time, even if everything's shut down. And that's so good. So I just want to say that. But what I've done is I hired, I guess it's been now 2 months ago, so about 3 months into it, I hired an assistant, someone I had worked with before, who's a health coach in her own right. And she is doing some of the back office, the ordering. Each patient that we meet with, we do talk to them about the patches and how we feel it could be helpful. And if they're enrolled in one of our plans, that is a part of that plan that they get automatically. Most patients are very interested in it. And so we work together in that way. I suggest and recommend whatever protocol I think is best. And usually it's the 4 patches like Marcy showed you. And then my health coach assistant follows up with them and make sure that it gets ordered. And we help them on the backside to get that ordered. And I love, by the way, this new Start X39 Now. This is just the best. I was looking at it when you mentioned it earlier, Marcy. I hadn't seen that one with this X39 Now, and it looks great.